mynews.studio.
Imagine a disease that blinded people for centuries. Now it's been wiped out in Egypt. What can the rest of the world take from this?
Today is 2025-11-21. Let's start simple. Egypt has just eliminated trachoma. That's the disease behind blindness for thousands of years, right?
That's right. Egypt is now the 7th country in its region and the 27th worldwide to eliminate trachoma. The main approach was the safe strategy: surgery, antibiotics, facial cleanliness, and improvements to the environment. But it wasn't just one solution.
So why did it work in Egypt when trachoma still affects people elsewhere? What set them apart?
Egypt combined the WHO strategy with national efforts. They spent over a decade mapping and tracking trachoma, making sure remote communities weren't missed. Clean water and sanitation mattered a lot too.
Hold on, when you say mapping and tracking, do you mean like detailed surveys or satellite data or?
Mostly on-the-ground surveys, but they also used digital reporting to feed data into their health system. It's that combination that made a difference.
Let's talk about what others can learn. Is it mostly about copying the SAFE model, or is there more?
There's definitely more. Egypt's approach was holistic. They brought together health, education, infrastructure, and involved communities directly. They built trachoma checks into their electronic disease reporting too, so cases are caught early and don't come back. That's something other countries could adapt for different diseases.
And it's not just trachoma. There's been real progress on neglected tropical diseases overall. The numbers are big. 58 countries have eliminated at least one, and last year, 867 million people got treated. That's WHO data for 2025.
Yes, and since 2010, there's actually been a 32% drop in people needing treatment for these diseases. That's down to pharmaceutical donations, national plans, community action, and new medicines and vaccines expanding what's possible.
This is bigger than just disease elimination. Child health is improving too. The global under 5 mortality rate has fallen by 51% since 2000. In some places, the drop is even more, over 75%.
Vaccines are a big reason why. In Africa, malaria vaccines in 17 countries have cut child deaths by 13% where they've been used. HIV treatment is also reaching more people, 25.6 million in countries backed by the Global Fund.
But even with all this progress, not every child is reached. What's still standing in the way?
Access is still uneven. Some areas have limited health infrastructure, poverty, or poor sanitation. Social and geographic barriers leave some kids out. What's helping are mobile health teams, integrating health and social services, and community health workers who know their neighborhoods well.
But with funding tight and new health threats emerging, are these approaches enough?
They're necessary, but not enough on their own. As funding goes up and down, countries need to invest in stronger health systems, form partnerships across sectors, and use technology to target resources. Still, without political commitment and community involvement, it's hard to keep making progress.
Does momentum risk stalling if politics or funding shift?
Yes, that's the risk. That's why advocacy for continued global support is key. International backing, tracking progress with data, and adapting strategies all help keep things moving.
So, in the end, the story isn't just about numbers. It's about what's possible when countries coordinate, commit, and involve communities. Would you say this is a blueprint for tackling other tough health issues?
It is. Eliminating diseases like trachoma and reducing child mortality show that with the right mix of interventions and partnerships, significant progress is possible, even for the hardest problems.
That's it for this episode. How global health breakthroughs are saving children and helping build stronger societies.
Thanks for listening. This episode was powered by mynews.studio. Try it for free.